anybody has any questions, please feel free to drop it in the chat box. We have the chat box, so you can drop your question at the chat box, or you can show your hand. You know that there is an option when you go in the manage participant place, you have the option to raise your hand, and you can do raise your hand to show that you have a question, or you can unmute yourself and just say salam and ask your question. There is from moderator sides, I don't have any objection, but we'll just wait until Bahar Bhai's presentation is over. I don't think during the presentation, Bahar Bhai, would you entertain question during the presentation, like interruption? I don't think that's a good idea.
Yeah, we'll continue at the end.
And at the end, you can ask question, and inshallah, we'll try to answer your questions. Okay. So without further ado, I will give the mic to Dr. Mohammad Hossain, and we all know him as Bahar Bhai. So please, Bahar Bhai, the session is yours now.
Thank you, Hafiz Bhai. Thank you, our community members. Assalamu alaikum.
Assalamu rahmatullahi barakatuh.
And thank you for inviting to give presentation on coronavirus pandemic. And I just want to add little background. Currently, I'm working as hospitalist at Duke Raleigh Hospital. And last previous 20 years, I have been working with All Care and All Med Clinic as a primary care physician, both in internal medicine and pediatrics. And also I worked at Rex Hospital for 15 years. And also I admitted a patient there and took care of patient also there. And I also admitted patient at WetMed, Raleigh and Cary, and took care that over the last 20 years. And it is my pleasure and honor to present these topics in this crisis time. And because of the situation, we all are worried because some of our friends and family members has been affected in different places, different states and all over the world. So as you know, the COVID-19 is an infectious disease and caused recently found the virus known as SARS-CoV-2. It also named as novel coronavirus or COVID-19. And this is a group of virus which was found in 1965 as a common cold virus. And then in 2002, the COVID virus 1 came as a severe acute respiratory distress syndrome, and it was started in southern China and affected about 28 countries. And by 2003, it caused 774 deaths. And then another came as a MERS, Middle East Respiratory Syndrome, and was originated in Saudi Arabia, 2012. And also 2,500 cases was found, and out of that, 858 people died. So this novel coronavirus came and started at China, Wuhan, China, in Hubei province. And then it spreaded very quickly in different countries, initially Iran, then Italy, Korea, and also US. And it declared as a pandemic by World Health Organization in March 11, 2020. And it usually the virus of animals, wild animals, it started from bats, pangolins, it is scaly and taurs, and some other wild animals like snake, rabbits, and this is the structure of the virus. You can see is a halo shaped and a spike, glyco spike surroundings. And this is the RNA virus, and it has an envelope, the RNA virus inside the envelope. And there is some you can see is a like a different spikes around the halo. And what it does, because there are different type of virus I discussed last time, DNA virus and RNA virus and retrovirus. So RNA virus, most of them are RNA virus except like DNA virus. But retrovirus, we know HIV virus, like influenza virus, they are also RNA virus. Then Ebola virus, they are RNA virus. Coronavirus, these are RNA virus. And also hepatitis C, hepatitis E, they are RNA virus. And hepatitis B is DNA virus. So
Bharbai, if please excuse me, I kind of like could not hold my curiosity here looking at this beautiful picture. It looks like a pretty picture, but it does a lot of harm, seems like. So I'm just curious, like it is one particular cell, am I right? It is just one cell.
just one cell, yeah.
Okay, okay. So it's most of the virus cells are like this, like it has
Yeah.
RNA or DNA strain, and then
Yeah,
RNA.
DNA is a double strand. RNA is a single strand most of the time.
And there is an envelope. The envelope is kind of like a membrane, or is it like a membrane?
Yeah, it's a kind of member or shell. It covers,
Shell. Okay, okay.
and then the spikes come out. The spikes, they helps to attach on the host cells.
And these are very symmetric. Looks like a circular symmetry. Is it actually like that, or you drew it like that?
Well, it is dreamed like this, but when it moves, it changes the shapes.
Oh, okay, okay, okay.
And then,
Looks like an artist's picture to me, but okay, go ahead, Bharbai.
so I will, next slide, you can see more. So what it does, it attaches with the host cells, because when it comes, initially they are virus from the animals, then it usually does not come to the human beings, but it somehow from the animals, it came to human beings and it founds in the market, seafood market. So thinking it came from some of the animals there to the human being. And usually what it does, it is an entry is
Bharbai, again,
restricted.
just sorry for the interruption, but I'm just curious. Like you said, it came from the animals, and the animals that you mentioned are kind of like bat, and then a snake and other animals. But you didn't mention about fish, though. So it came from the seafood market. So can you just hint at all? I mean, what could be the reason that it came from the fish then?
Well, we don't know fish. These are from the wild animals. So it could be from snake, but usually fish we don't see.
Oh, okay, okay. So
Yeah.
the seafood market in China probably, they also sell a snake or a
But,
stuff like that. So,
yeah, snack, or it could be contaminated water. We don't know.
okay,
You know.
okay,
So
clear.
somehow it came from the animals, but the people there, they are infected more, and also some healthcare worker infected. So we don't know what was the source, how it came, but usually thinking maybe contaminated water or, you know, or from some animals. It came, we don't know actually. But I'll put slides, then you'll know more, when the slide comes. So usually the point of entry is the respiratory system, and it goes to the lungs and alveoli, and they took the host cell, and how they start working, they attached with the cell, and then this cell go inside the host cell, and they attach that they replicates, and then they transcripts, and then they translate, and they get assembly again and release from the cell. So they came out from cell. So one cell go inside, and then it came, multiple cells come out as a mature, RNA virus. So let me go to the next slide. This is the global infection background. And from the China, Wuhan, we said now globally it affected, from December till end of the April, 3 million people get infected, confirmed case. And then out of 3 million, 228,000 deaths, globally. So now you can see how serious this. And also it came to United States. We don't know, it started in Seattle, Washington, the first case, but we are not sure, maybe some case came earlier, but was not confirmed. But as for now, we have 1 million of infections and about 61,700 deaths. So about 5.8% death, and 127,000 recovered, as for in the USA, statistics. Now in North Carolina, so far we see 9,948 infection, and out of that is 354 deaths. Wake County is 788 infections and 16 deaths. So in Bangladesh, I just got some information from there. It's 7,667 confirmed, and death is 168 confirmed. But from Bangladesh, we don't have enough tests, so this number is increasing. So now we go, because of this, severity, now, we found that the high-risk groups, who are the high-risk groups, we see those have poor immunity, they cannot fight, then they get more affected, like advanced age, and somebody has COPD, diabetes, or end-stage renal disease, cancer, taking any immunosuppressive medications, has coronary artery disease, with severe coronary artery disease, and obesity. They are more affected, more vulnerable, but it can infect any age, any any religion, any male, female. It does not discriminate, or poor, rich. Everyone can be infected or affected, but these are the high-risk groups who get more fatality.
Bharbai, what was COPD? If you just
COPD
mentioned,
is
but
a chronic lung disease, chronic pulmonary
pulmonary disease. Okay.
Yeah. Chronic obstructive pulmonary disease like asthma, COPD. Asthma is those has allergy and then develop asthma, and those people are COPD, a smoker, they usually get COPD, when they get more older or aged. So these are high risk people. Now, what are the symptoms? So we see more than 50% infection are asymptomatic because they feel normal person, they get infected or exposed, but they don't because they have a good immunity, they fight back, or maybe viral load is low, so they don't have any symptoms. So they are, for other people, these are more um, dangerous because when you don't know, you cannot do any prevention or protection. So that's why usually nowadays we say use mask, all the time, because so you can prevent the spread to other patient or other people. So that's why now it's become a standard to have um, use the mask. So now, what are the symptoms when it shows? Usually, it is different kind of symptoms, but usually it can happen. Start with fever, or weak lethargy, or dry cough initially, and then some of them can experience headache, and then loss of a smell or taste without any reason, then running nose, sneezing, sore throat, dry cough, fever, myalgia, muscle pain, and also shortness of breath, nausea, and then sneezing, generalized weakness. Sneezing can, if symptom, you don't have fever, or if you don't have other symptoms, only sneezing. Now during pollen season, a lot of people is allergic to pollens, dust. It does not mean only sneezing is coronavirus. But when it comes all other symptoms, it can be, from the virus related. So usually we can tell generally like a flu-like symptoms, because we are more familiar with flu, you know. So similar symptoms can come. So sometimes the loss of a smell and taste, because I had one patient, she had headache, she had nausea, and she had a smell, loss of a smell and taste both. And she was having dry cough and fever and with muscle pain. So these are common symptoms. Now, how when it enters to the respiratory system, how it start, affecting the humans. So what it does, the respiratory system, when it enters to the nose and then in the larynx, then trachea, then the bronchioles, then we get the unit alveoli. The respiratory unit is alveoli. And alveoli has uh, two kind of cells, the type 1 pneumocyte and type 2 pneumocyte. So type 1 pneumocyte usually helps oxygenation in the alveoli, take in oxygen, and they, from the environment when we breathe in, so they take oxygen to our blood system, they send in the blood system, we get oxygenated blood. And then they take from our vein system, the carbon dioxide, and then when we exhale it, the carbon dioxide takes out. And the type 2 cell is the actually homeostasis of the alveoli. They give nutrition, they support, and they keep alive the alveoli. So the coronavirus attacks the type 2 alveolar cells, and that is the host cell where they go and attach to enter inside and attach to the ribose, and then they started, you know, uh, the transcripts, then the polypeptides, they make translation and transcription. So they make, polypeptide chains, and the RNA-dependent polymerase, they helps the regeneration of the new viruses. And here, the damage, when they attack the host cell, enter the host cell, our defense mechanism start working. They try to fight back the virus. So our cytokines like interleukin 1, interleukin 3, interleukin 6, what the interleukins, they try to fight back. So we get immune response. That's how when the cells dies, they get debris and they started to become pneumonia. So we call in medical term is pneumonia. And usually it goes to different cells, so they get, multiple places, they get patchy opacities and pneumonia. So
Bahar bhai,
yeah,
just a quick question here. As you mentioned, like type 1 cell is that helps us the osmosis process of like oxygen goes into the system and carbon dioxide comes out through the alveoli. Is the type 1 cell is responsible for that? Am I right? Or you
yeah.
said type 2 cell?
Type 1 is responsible for
Oxygen
exchange
exchange,
of oxygen and
carbon
taking,
dioxide exchange.
yeah, when we inhale, we take oxygen, and
Right.
that goes to our body inside our circulatory system. So the capillary, they
And
absorb.
what is the function of type 2 cell, Bahar bhai? Did you mention it?
Uh, they keep they are the support system. They are the homeostasis. They keep the homeostasis, means they keep the nutrition to the alveoli, and then they keep the structure, and then we have some fibroblast. They helps in, like coil recoil, so it like work as a pumps. But type 2 cell helps nutrition of the alveoli. They support the alveoli to.
And that is the cell which is being affected by this virus. Am I right?
Right, right,
Okay,
exactly.
great, great.
So that's
Okay,
the
clear.
cell they affected. And without that, the alveoli cannot support, they cannot
Okay,
function, can do other things.
great. And
Yes.
whenever we call it pneumonia, when that means pneumonia means type 2 cells are damaged, is
Yeah.
it? Or
Eventually type 2 cell damaged and the other cells also damaged.
okay,
But it start with pneumocytes type 2. That's how we get pneumonia. We get build up fluid because of immune response. All the debris and then the fluid comes, inflammation starts. So then the inflammatory cells, they fight with the virus and the cell become damaged. So cell become dead. So that's how we started to see the opacity, it's like hazy, like a dead person, like a dead body, like dead cell.
thank you, Bahar bhai, for clarifying that.
Yeah, no problem. Yeah, if any question like that, then I can, stop and explain. That may be a good idea. So now when we do test, usually um, we see in the blood test some leukopenia, the white blood cell count go low, and the lymphocytes, their type of the cells, they also decreases in our body. And thrombocytopenia, the platelet count also decreases. And as we tell, when we do X-ray or CT chest, we see ground glass opacity or pneumonia. And then in severe case, when
Bahar bhai,
uh,
just one question came, since you already passed about the symptom part,
Mm.
A question came regarding a symptom.
Yeah.
Um, and uh, is Marjan, do you want to ask that question? Marjan, can you unmute yourself and ask that question?
Yeah, sure. You can ask the question.
Yes. Assalamu alaikum.
Walaikum assalam.
Yeah. So my brother, he's suffering from fever for past few days, like for past 5 days, and then he also has severe body ache and headache. He also has nausea and vomiting. He has been tested for COVID-19, but we have not received the report yet. So we have been giving him Tylenol for the fever and pain, but it is not showing much effect. So I was wondering, can we give him ibuprofen? And if so, then what should be the dosage? He is 19 years old and his height is 5'9" and weight 215 pounds.
Yeah.
Barbara, the questioner is also MBBS from Dhaka. She got her MBBS degree from Dhaka. She just arrived here in Texas. Okay.
Yes. Yes. Yeah. This is a good question because Tylenol is the first choice in medication, and other things you can do is sponging with like cool water, and dress can be taken, out, so get minimum, get a more exposure so that the temperature can be lowered, especially sponging, and cool water, um, and also Tylenol. Now for ibuprofen, usually we are hesitant to give because it can cause anti-inflammatory effect. So is not, we are not sure, but still some people say, this is not good to use for now. But if it is, like, is you try to keep it less than 100 or 101. But if you get too severe, like 103, 104, then I think in that case, we don't have choice. Then you can use lower dose, as possible, like maybe 200 milligram 3 times a day, So how old is he? 18, right?
He is 19 years old. I
19.
have one more question. They did his blood work and his platelet level was low. It was 95,000. So
Mhm.
is there any connection between the COVID-19 and platelet? Should we be concerned for that?
Yeah, yeah. In that case, that's why we don't recommend ibuprofen because the platelet in COVID, you can get thrombocytopenia, low platelet and low lymphocyte, low, um, low leukocyte. So if you get low platelet, if you get ibuprofen or aspirin, so they can decrease the platelet and can cause bleeding. So that's why, we don't recommend ibuprofen or, Advil or any NSAIDs and aspirin, unless if it is, life-threatening.
Thank you very much, sir. Thank you.
Yeah, so I think I have slides next, we'll discuss some more
Okay.
here. Here you see the labs, leukopenia, lymphocytopenia, thrombocytopenia, and the chest x-ray, we see opacities for pneumonia, and if it is develops ARDS, like multifocal patchy opacities all over the lungs. And usually test is, there is two kind, they are doing PCR test, but the PCR regular test, it takes some places like 3 to 4 days. Uh, and in the hospital, it takes 24 hours. Now, rapid PCR test we are doing, it can be done within maybe an hour. And rapid PCR test is more promising because it less false negative, but the other test is more false and negative. 25% has more false negative test. And so we still we are doing, if you have symptoms and if it is not, uh, is it false positive, I mean false negative, then we cannot say if it is negative. So we repeat test maybe after 24 hours or after 2 to 3 days if it is still has symptoms. So that's why we have to be careful if it is negative, but it still has symptoms. You cannot rule out. You cannot say it does not have COVID-19. So that's the important for the test results, and usually the healthcare providers, they monitor that. So now let's go back how we can prevent, because we know this is a serious disease and outcome is very bad. So now
Bharva, you mentioned in the previous slide one thing about rapid PCR test. What is that, and why the healthcare providers don't do that test as soon as the patient arrives?
no, healthcare, we are doing it, in the hospital usually.
The rapid PCR test, and it gives the result right away, or?
Yeah, within an hour it gives the result. Then we separate, that this is not COVID and this the other one is COVID. We admit them separately in different unit. But still, if somebody has symptoms, we admit, we keep isolation that patient and repeat the test after 2-3 days or 24 hours to confirm it.
So my question to the other Marjan. They did not do the rapid PCR test on Shadman, like just the
outside
result.
it's still not available.
Oh, it's still not available. Oh, okay.
Not outside, but in the hospital, they are available. I think only in the hospital.
Oh, okay. Clear. Thank you.
Maybe it may be more costly or not, cannot do more, too
Okay.
many at a time, because they have some limitations. I don't know exactly. But usually they are just doing in the hospitals right now. But I think eventually they might send the kit, at home. That's the future. They can do collect the samples and send, to the lab. I think they are working on it. And also some clinic, they are sending the samples, and some like clinic, they are doing collecting samples and sending it. So gradually the testing is getting better, but before, because of the availability was not that much, so it was less testing. Now we're doing more test. So now any other question regarding test? Okay, let's go to prevention. So this the prevention, as we know, is incubation period is 14 days, and most of the patient, they develop the symptoms after 7 days, 7 days, and then get sick very rapid. Within 1 day, 2 days, they get respiratory symptoms, get severe disease. A lot of patients. So now it's important to do prevention. So as we know, the methods of prevention is like hand washing, with soap and water, and also alcohol-based sanitization, more than 70% or more than 60%, they say. And then distance, social distance, like at least 6 feet. And then face, avoid to touch face, eyes, nose, and mouth. Then cough, you have to prevent if you don't have mask. Usually now it becomes a standard to use mask when you are outside. But if you don't have mask, you can use some tissue or band on your elbow and prevent the cough. That's how you can spread the droplets, that to the other people. So that's how you have to prevent it. And also if you started having more coughing, congestion, you need to stay home and quarantine and seek medical um, attention, and also follow the CDC guidelines. You all is easy to get access to CDC guideline, and you're aware of that. So you need to use CDC, World Health Organization, and other, preventive Europeans, ECDC. So World Meter, they have a lot of information regarding prevention. And now let's go how we can manage if we get sick. We already get one question, but I'm going to go details. You go self-quarantine when you suspect and isolate yourself at home, but still you use balanced diet, drink enough fluid, do normal activities, and communicate with your physician and your family, your friends, and try to get less, minimize your stress, because when you are at home and you isolate in one room, so you can get a lot of stress. So you have to share with, with your other family members. And we also see a lot of, blood clots, and because of inactivity, so, DVT, pulmonary embolism is coming with the disease. So you have to keep your normal activities, and some exercise as tolerated. And even at home, you can use mask, gloves, and also monitor your temperature. And as I told you, cool water, sponging, Tylenol as needed, and home testing is not common yet, but I think eventually that will come. And if you have moderate symptoms, then you can stay home, but you use albuterol inhaler, as a bronchodilator, and you can inhale like warm water vapor and drink warm water, then do breathing exercise, inhale, exhale, and eat in prone position, that helps breathing because of the position of the alveoli of the lungs. When you get prone position, you get more surface area. So you can.
Bahar bhai, there is a question about this prone position. What exactly does it mean? একটু দেখাবেন আপনি মানে
So usually we lay down on the flat on the side.
Right.
Prone position, like when you face down.
Okay.
And went down, with you lay down on your knee and elbow, that you get more the lungs, and the back side, the posterior side is more surface area. So that helps, more air exchange, because when you get pneumonia, so you cannot exchange the oxygen, so you cannot get the oxygen in and carbon dioxide out. That's how we started giving respiratory distress and shortness of breath and cough.
So is it kind of like ruku, আমরা যেভাবে নামাজ, the way we do ruku in prayer, or
Yes.
sizda, close to sizda?
Yes, exactly. Yeah.
Okay.
It's a good example.
Okay.
That will help your breathing, So maybe you can keep heads up sometimes, so you don't get, but this is a similar position. You can change your position on and off, but you have to be active, so you don't get, other symptoms. So hopefully you don't have to go hospital. But if his temperature is getting high, not controlled, like the other, brother, and also if shortness of breath is more and getting more lethargic and weak, is better to go to hospital, and or go, because you're developing severe, and you don't wait, So you call your doctor or go to hospital with your, car, or you can call to 911, get ambulance. It depends how severe the patient is. You have to make decision according to, the situation. And then, and other thing is communication is important. Maybe if you are only one person in the home or only two-person, but you don't relate with your family or friends, you don't know, within few hours you can get very sick quickly. So you might thinking that I'll be fine, but you don't have time. So that's why it's better to update your family or friends, time to time, like, in at least 6 hours, 4 to 6 hours in between, so that other people know how sick you are. They can call 911 for you. That could be life saving. So any question regarding this, so I can maybe answer, if a related question.
Yes, I have one more question.
Mhm.
So yesterday we took my brother to the ER and emergency room, and they repeated his blood works and gave him IV fluid and pain medication, but they didn't admit him. They sent him to home. But from last night, he has severe headache. He explains it like he's feeling his head is heavy and also a little pressure on chest, not breathlessness, but he's saying it's like deep breath. He's taking deep breath. So when should we be alarmed? When should we take him to the hospital, or should we be concerned now? We are little confused since his test result has not come yet.
Yeah, so usually when you are like talking, when I'm talking, you still I'm getting shortness of breath. Like, this is the early symptoms to, shortness
Okay.
of breath. So only deep breath may be okay, but you have to every 4 6 hours you need to watch. Like when he is talking, eating, or walking a little bit, getting shortness of breath, it still may be okay. But when you are sitting and still you are breathing short, you're, more like your respiratory rate like more than 30s. Normal is maybe 12, but your 30s. So when you are, at rest, you are coughing and getting shortness of breath, then I think you cannot wait. Then you have to go. But still you can get shortness of breath with walking, talking, eating, you know, but does not mean that you have to go hospital. But when at rest, you started shortness of breath, and if your fever is very high and you are very lethargic or sleepy, drowsy, then, so it is good idea, go to emergency room or call to doctor, or call some hotline. They can monitor closely.
Okay. Thank you very much.
Okay. So usually in the hospital, when we hospitalized, severe patient, initially we give oxygen, and if it's dehydrated, we give IV fluid. But if it's drinking, eating, okay, then we don't need IV fluid. And also we watch nowadays. We give DVT prophylaxis because some of the young patients we saw they're developing blood clot. Yeah, we don't know why, because maybe due to inflammation and also the damage of the endothelial cells and the blood clot, like DVT and inactivity, when they are laying down, they are very sick. So they lay down most of the time, cannot move. So they're getting DVT and getting blood clots and go to the brain, go to having a stroke, go to the lungs, getting pulmonary embolism. So nowadays, that's why we recommend to keep active when even we are sick, mild or moderate. You keep your, even though you have shortness of breath, you stay active. And then
Bharvai, a quick question about this DVT profile axis for like common people like us. What does that mean? Because of you are saying that because of coronavirus, you are seeing some patients are developing blood clotting. Am I right? Did I
yeah,
hear it correct? Oh, okay. So,
blood clotting,
which is,
then what is the blood clots is small microthrombus, the small blood clots, and when they get together, get bigger one, and they
so like
circulate
some
in the blood system.
something called like thrombosis, is it? Or
Exactly, yeah.
okay, and that could cause like a stroke, as you said, like it can
Yeah.
cause a stroke.
So this blood clot can travel through the bloodstream and go to the lungs. It can cause pulmonary embolism and go to the brain. It can cause a stroke. We call a stroke. They go to the small vessels. They block the circulation. Then the cells die in the brain, and it causes the stroke.
So the treatment that, what type of treatment you provide, aspirin or ibuprofen helps stopping the clot, but you are saying that that's not suggested. So what type of treatment do you provide there?
Yeah, usually we give in the hospital, we get Lovenox because the aspirin and ibuprofen, they decrease the platelet count and it increase the blood clot. So we give like Lovenox or heparin. So we give lower dose is called prophylaxis. But if you develop blood clot or pulmonary embolism, blood clot in the lungs, then or the stroke, we give heparin, and still we don't know. It can cause also bleeding, but you have to watch, and monitor, and that's why we treat. Some people can die from hemorrhage, but we have to take risk and benefit depending on the patient and depending on the severity and the other comorbid conditions of the patient. And then next step is we give ventilator support. We intubate and give ventilator support so we can breathe, give the oxygen, so the person can get oxygen, because for our survival we need oxygen. So that's why we do intubation. Then we have to monitor blood pressure if it inflammation and the patient can get shock. Then we have to give some medicine to increase blood pressure. And also we have to watch the kidney function. Sometimes if he's got kidney failure, we have to do dialysis. Everything depends on the severity, of the disease. And usually people die with pneumonia, hypoxemia, ARDS, thrombosis, stroke, renal failure, cardiomyopathy, and the multi-system failure. And this can cause very rapidly. When we treat with medication, some patient does not respond when the multi-system fails, But other good thing is 80% people recover from this disease without needing any special treatment. But still a trial is going on. No antibiotics have shown efficacy, like hydroxychloroquine, and anti-malarial drugs like chloroquine. We're treating. I'm going to next slide. I'll discuss with that. But usually those people are mild or moderate recovered or even severe, they recovered, what are the things we have to do? I'm just giving little information. So usually you have to do balanced diet, exercise, minimize your stress, because a lot of people we saw because of this cannot handle the stress. They get depressed, and sometimes that can cause more isolation and can cause more problem to the patient, to the family, to the community, when it involves more. So that's why you have to follow up with your doctors, primary care, pulmonologist, your psychiatrist. If you have problem with psychiatry or mental depression, you need help from there. Okay. So now the trials of the medication, I showed up the slides here. So anti-malarial and azithromycin, they're having trial in different universities and hospitals. And so how this works, so anti-malarial hydroxychloroquine and chloroquine, they prevent the entry in the host cell. So when they get attached, then they prevent it. But it did not, and also azithromycin like Z-Pak, they said to enhance the work of hydroxychloroquine. But we are not sure yet, but still trial is going on. And then we have trial going on antiviral like remdesivir. It helps in RNA polymerase inhibitor. It works as an inhibitor of RNA polymerase. When the RNA virus, they started transcription and replication, and they get proteolysis, and with the polymerase, RNA polymerase, they multiply, they make new RNA virus. So RNA polymerase inhibitor, this remdesivir, it used in Ebola virus in the past. So they are working on it, and 100,000, I think, randomized trial was done. And recently, I think yesterday was announced that CDC and Dr. Palsy, give the information that it decreased the duration, like from 15 days to 11 days. And we don't know, it might reduce some severity or symptoms, but we don't know yet mortality reduction. So, and there is some trial with other antiviral. So this might, if we use combination, might help. So still we are getting some hope, and trial is going on. So is a trial going on in Europe and US. They are doing combined trial. So some antiviral used in HIV like lopinavir, ritonavir, and also umifenavir, favipiravir. They use this, they are going trial. So if one works, they might add another one. So the sequence, they can prevent the different sites. Hopefully that might reduce mortality and severity. So there's some trial going on. So usually Pfizer and some German company, they're doing it. They're thinking maybe end of 2020, so they might, or they are trying some vaccination. So they are thinking maybe end of 2020, they might develop some vaccine. and also UK, Oxford University, they are doing some trial with vaccination. So at least 70 trials has been on progress for vaccination. So like flu vaccine. So they are trying it. So maybe it takes 1 year to 18 months. So many initially they might do small, um, and then they will do more. And then to develop it, they need millions and billions of vaccine to cover whole world. So hopefully, beginning of the 2021, we'll get some vaccination.
Any efforts in the United States, Bahar
Yeah,
Bhai, as you
the
know it?
United States and the Europe, they are doing combined. It's
Oh, okay.
already in Duke, UNC, and they are doing trial. They are part of these trials. So
Okay.
US is part of. They are doing like more bigger. So they did some smaller. So they are doing more bigger. So that's why it takes time to develop the vaccine. So and these are the medications and trials. So now that's why now we are mostly depending on the prevention as a prevention. I like to tell, other thing is like when we go outside, it is advisable and recommended to use mask. It prevents a spread to other people, and also using mask, it might help you some to get in. And when you have mask, you don't touch your face or mouth that frequent. But if you get contaminated or it get spoiled, you might need to change it. So now there are people are using different kind of mask, but N95 is healthcare for the healthcare worker. N95 mask. I know this is different than surgical mask. N means non-oily. 95 is, they can prevent, entry of, they can filter out, zero point 0.3 microns diameter particles up to zero point 0.3 microns. Larger than that, they can prevent. So we use when we take care like airborne diseases, like TB. So that usually used for healthcare providers because the coronavirus is droplet, but it aerosolized, it can float in the air. So they don't say airborne, but it can be airborne, if it is too much virus, in the air or when it dries up or give aerosol like intubation, it can, spread in the air. Or if you give a nebulization treatment, breathing treatment, or cough, it can be floating in the air. So that's why we use. And nowadays, the N95 in the hospitals, they can reuse it, with can get disinfected. So let me go the last slide, and then we can start general question. So thank you very much for listening, and I hope this education will help to everyone and in the community because we already see the result here in North Carolina. We were thinking that it might go to a spike end of the April, but it never happened. And also we're thinking maybe mid-May, but it looks like our trend is not trend is good because it coming sporadically is still going high, but not like New York or metro area or other places. So it is still staying low threshold. So if we get sick, these still hospitals are facilities can take care. But if we have patient, we will sick patient like 100 or thousands, then we will unable to able to take care in the hospitals. And good thing is the hospital, UNC, Duke, WakeMed in this area, they are working with governments, working with healthcare facilities and nursing homes, where more can be like quite place where in prison systems, like confined area where it can be more people get sick. So they are working on it. I think the spread is less, but it can turn back if we don't follow the recommendations. So and thanks God, there is still in better shape than the other. But it will be difficult to keep this way because still we have to go work, we have to go shopping, for our food, basic needs. So try to minimize that. And also when you get food, try to get disinfectant. Use cautiously, don't get poisonized. And also clean your shoes and take shower when coming out, or use mask and gloves. So you use all precautions, and think about virus can come inside your home and can infect other people, your loved ones, your young children, your parents, elderly parents, or somebody sick, low immunity, somebody is sick, it can spread. So it is my earnest request that you follow the recommendations and guidelines, and hopefully we can keep our, spikes low. So, but stay safe, stay ready, get preventive measure. If you have to be quarantined, keep food for 2 weeks at least, and please stay strong, eat balanced diet, do exercise, and stay connected, especially if you're single or 2 person or less people at home, and take care each other, stay healthy. Yeah, please, and get up to date. And if any question, I'm available, all the time, so if you need, I'll be open for any advice or suggestions. Please help each other. That's how we can go back to our regular life soon, inshallah. Please, if you have any question.
Thank you very much, Bahar Bhai. Does anybody has any question? You can raise, you can just unmute yourself and ask the question, or okay. So Bahar Bhai, I think there is, I'm not seeing any questions in the chat box, so I think we don't have any other questions at this moment. So thank you very much, Bahar Bhai, for your kind presentation, and I think it was very useful. It has a lot of information which are kind of beneficial for us. Even as a common person, I could understand a lot of it, and it really was very, very helpful. And we pray for you that Allah keep you healthy and you are in the forefront helping other people. So inshallah, Allah keep you healthy, and thank you very much once again for your time, and we look forward to hearing back from you again, inshallah, in a couple of weeks or if possible. And with that, if anybody does not have any comments or questions or concerns, we will end our program session today.